Father and son board a bus at 5:30 a.m. for the 3-hour trip from their home in Easton, Pennsylvania to New York City. The doctor is Elliot Jacobs, a plastic surgeon who specializes in gynecomastia.
Hi, Rohan. How are you? Good to see you. Okay, come on. Are you ready to go? Well, let's take a walk. Come with me. Rohan is a 15-year-old boy who came to me with a complaint of gynecomastia, enlarged breasts, which were preventing him from engaging in the usual activities that the 15-year-old boy would do. When I grew up, I had gynecomastia, and although it's a mild case, I went through a lot of what my patients have been through, and I totally understand and sympathize with them. All right, well, let's take a look at you. All right, and now I need you to sit up nice and tall. Okay, so I can feel some very firm breast tissue inside on both sides, okay? And that's the kind of thing that we can deal with and help you get rid of it in order to flatten your chest, okay? Rohan has had this for a number of years. It reached a certain point. It is stable. It's not increasing at all. He is basically physically mature. All right, and I'm going to do the same thing on this side. I think this is the right time to do it.
The anesthesiologist prepares Rowan for the surgery.
Right from the Himalayas, pure oxygen. Excellent.
Rohan is a bit more of a difficult case because his breast tissue is very, very concentrated.
Some of the mass in Rowan's chest is breast tissue, some is fat. It will take 2 surgical procedures to remove it all.
When the breast tissue is standing up as it is here, it tells me that there is sufficiently firm breast tissue in there so that we will more than likely have to make a small cut just around the edge of the nipple in order to finalize the removal of tissue. Okay, the next step, we're going to inject tumescent fluid to soften the fat in the breast tissue, makes it mushy and easier to extract.
300.
The tumescent fluid has ingredients to control pain and bleeding.
All right, next step is going to be liposuction. Liposuction is the blunt removal of fat, and in this case, fat and breast tissue. Next step, we're actually going to open up that area.
Dr. Jacobs removes the breast tissue under the nipple.
One of the important things is how much you leave, not always how much you take out. These are dissolving stitches. Let me show you how loose this skin is. And I'll come back to it at the end of the operation after about 45 minutes, and you'll take a look at the skin and see how it has changed just in that brief period of time. Here we go, side 2.
The surgeon repeats the procedure on the left side.
We're pretty much finished. If you remember, this was very loose, and now, if you could see, that skin has already begun to tighten up. I'm very pleased the operation went well. We got Rohan nice and flat, and I think he's going to be a very happy camper when he wakes up, which will be in about 10 minutes or so.
There you go. Wow. Disappear. That magic. Oh, I can't find a word to really express, I am so thankful.
In a few hours, Rowan and his father will be back on the bus, heading for home and recuperation. Rowan Rowe and his father returned to New York City. It's been 2 months since Rowan last saw Dr. Jacobs.
Rohan, that's right.
How are you? Good to see you. How have you been? Good. Now it's time for me to take a look at you, okay? So if you don't mind, just take your shirt off for me. Okay. Everything is healing extremely well. Your skin has tightened up significantly. Some of the discoloration that you had on the skin has diminished somewhat, and I anticipate that the skin color will eventually equal out and be totally normal.
Ralston notices the change in his son's behavior.
At first, he didn't want to go to gym to take off his clothes, you know, because of how he was looking. But now, I don't think he's ashamed of it now. He can hold up his head now.
With a pumped up self-image, Rowan is eager to hit the gym.
Always, you know, try to hide his chest. But now he's proud. He don't have to do that anymore.
He's still shy, but Rowan's self-confidence is growing every day.
Just feel feeling like I'm just a normal person.
Did you know that breast reduction now ranks number 4 on the list of cosmetic procedures performed on men?